I want to start by saying there's pretty much nothing monolithic about the Black experience. However, almost every Black person I know, everyone I consider a friend, a family member, has had their parent have the talk with them. What to do when you get pulled over to not be profiled. Where to keep your hands. Don't make any sudden movements. Ask and over-communicate when you reach for the glove box or to take off your seatbelt. Hands at 10 and 2 at all other times. Yes, sir. No, sir. Yes, ma'am. No, ma'am. Even if there's an injustice against you, let mom and dad, let a loved one handle that. You know, the goal is to get home alive. The goal is to get home safely. I'm going to ask you to walk in a different pair of shoes, those of Black people profiled in another aspect of life, another aspect that could too mean the difference between life and death. So what about somebody watching who may say to themselves, I don't see color, it's the human race, so when I'm dealing with these patients, it's the same thing. How dare you? What would you tell those people?
There's actually very hard concrete evidence that says differently.
So I am a cancer survivor. It'll be 2 years in June. When I first started talking to my doctor at the time, about years ago, when I said that I was having problems with my menstrual cycle, he told me it was because I was fat. He said, you just need to lose weight. That's it.
As a first-generation free Kenyan, those disparities were shockingly apparent to me when I moved to this country, and I said, oh my goodness, in the land of the free and the home of the brave.
We should not get to a point where I'd rather choose losing my life than to deal with a doctor.
How important is empathy in all this? What role does that play?
Gosh, what if you really could feel what one person or a community that has felt neglected for centuries? What if you really felt that?
Building trust a lot of times when you first meet someone allows for better outcomes.
The same way that we have to present ourselves a certain way in encounters with law enforcement, right? The same way we have to be on guard for how we look and how we manage ourselves when we're walking through a store, because someone may stereotype us as possibly, shoplifting, right? So all of those ways, right, that Black folks have to negotiate, right, with how they are being perceived, right? It's an all-encompassing thing in our everyday lived experience. It should not be that way in the doctor's office as well.
Over the next half hour, we're going to explore the issue of inequity in care, how certain people are treated differently in medical settings. You know, it can have dire, sometimes even deadly consequences. You'll hear from patients who have experienced it, doctors who have witnessed it, and the people who are all gathering all of these stories for something called the Repair Project. Now, the goal here is to preserve history and change the future so that everyone can access quality health care no matter who they are. So let's get to it. For some of us seeking medical care, it's not a positive experience. And as we explore inequity in care, we're hearing experiences just like this.
I had a doctor who really did not listen to anything I said.
Can you relate to that? If so, you're not alone. In fact, Black people are significantly less likely to be believed when they say they're in pain. In fact, a 2016 study showed 40% of first and second year medical students still believe the false idea that Black people's skin is thicker than white people's. Yeah. In part one of our Inequity in Care series, we introduce you to some of the doctors, patients, professors, and other advocates coming together to break this cycle. Now we're going to dive deeper into how sharing these personal stories will make a difference. You know, sometimes you really have to laugh. Oh, you guys know the story?
Oh, I got stories for days.
The running theme.
To keep from crying, Kim Weaver and her family endured a fair share of both.
My daughter has 2 birthing stories that she almost died through at 2 different hospitals.
Her daughter was in labor, just 27 weeks, bleeding profusely, requesting pain medicine doctors say they ordered, but never did. Thankfully, both of her babies lived. But for this now grandmother, there was even a bit of deja vu. You see, years ago when she was having her first child,
I had premature labor.
She gave birth to a stillborn.
But before that, they had gotten a heartbeat. And so while I'm in labor, they're saying, well, your baby's been dead for weeks. And I'm like, no, they had a heartbeat downstairs. And they're like, not possible.
Turns out she was carrying twins.
And it took a nurse coming upstairs saying, yes, I did have a heartbeat. There was a baby still there for them to realize I was still in labor and having another baby that they weren't prepared to help save.
Walk me through how you felt.
Oh, I was, in that moment, tired. I mean, I was 19. And what do you do when you're arguing about they had a heartbeat downstairs in the emergency room and the nurses are telling you that's not possible? I was not being heard. And I think I was not being heard because I was a young black woman.
A lot of people are not aware that they have bias,
including medical professionals, which is why educators at the University of Kansas Medical Center are prescribing an ounce of prevention rather than a pound of cure. You see, these three people are on the front lines of something called the Repair Project, performing surgery on the syllabus and curriculum for future doctors. Dr. Jason Glenn is the project's primary investigator and executive director.
It's based on one simple premise. How do we at academic medical centers repair the harms that have been done over the past centuries, not just in the mistreatment of people of color in the clinical encounter when we go to see the doctor, but also in the misrepresentation of people of color in the curriculum.
So the project aims to address racism in medicine from 4 angles: curriculum development, continuing medical education, addressing unequal health outcomes, in collaboration with the community. Dr. Geraldine McGee and Danielle Binion both work in the Office of Diversity, Equity, and Inclusion for the University of Kansas Medical Center.
So it's important for me that healthcare changes, right? And that it's more equitable, not just for people who look like me, but for all people who are marginalized.
I think it's really important for faculty to own up to what we're teaching, and that's one of the things that they're doing. So they're taking a look at the curriculum in order to make those changes.
And people like Kim Weaver sharing their stories, which will then be used to break down stereotypes and build trust.
So if we can provide a space that they can be heard and we can validate them, and then we know that we can use that again to help change how curriculum and students learn, we can change it for future generations.
Still ahead, we will take a closer look at the KU Medical Center's Repair Project and how they'll use stories like Kim's to change how current and future doctors treat their patients. Welcome back as we continue to look at inequity in care. We've been sharing stories of people feeling dismissed or even unheard by doctors and other healthcare professionals, but what's the purpose of sharing these stories?
We cannot heal, we cannot repair until we understand the stories and what happened in real life, and not just speculation. We have broad strokes of stories, but the Repair Project gives us the specific cases.
We want to take a look at how these stories will help current generations heal and protect future generations from that same trauma.
Kim, tell me what to do.
No.
2 dear friends and co-workers.
Are we recording right now?
We are now.
Oh, shoot. My bad.
Bonded by laughs, spotted by motherhood, and bonded by trauma.
Now I'm in my 30s, and it took all those years for me to understand that I was a victim as well.
What did the doctor do to make you feel unheard?
For instance, I remember I was heavily medicated at one point, and it was just like the conversation never happened with me. It was around me.
In part 2, we told you about Kim and how her daughter thought she was going to die during childbirth. You know, Kim had similar thoughts when she became a first-time mother herself.
I definitely have trauma with having childbirth.
Shalise did too.
I had a doctor who really did not listen to anything I said.
And it's not far-fetched. The U.S. has one of the worst maternal mortality rates in the world. Nearly 33 deaths per 100,000 live births. That number in Austria, Japan, Spain, Israel, for example, between 2 and 3 deaths per 100,000.
Oh, I was angry. I'm still angry.
For good reason, too. Women of color are 2 to 3 times more likely to die from pregnancy-related causes than white women. And when you feel unheard,
You don't go get care if you don't feel like how you feel is valid.
that's where the Repair Project comes in. These 2 victims are some of the volunteers now collecting stories just like theirs. Some individually, some in listening sessions where people who feel wrong during medical care based on their race can discuss those experiences.
I collected 20 women's stories in maternal health. And each and every one of them, except maybe one, the same cycle. I didn't feel heard. The doctor didn't listen. They told me I was okay.
As long as we're talking in vagaries, nothing will happen.
Eventually, the answers to how we repair it will be housed here at the Black Archives of Mid-America.
But when we have specific stories and their faces and their lives and there are people connected to those stories, then they become real. And then we can look at them differently, and then we can also heal from that.
and fix how we teach and recognize bias in the classroom. Carmeletta Williams will oversee how those stories are on display.
We need the real stories. We need people to come and talk to us about it, and then we can do something about it. We can't fix it if we don't know what it is, but we also need to tell other healthcare professionals and facilities that when they train physicians and nurses, that these are some things that they have to consider, that they have to move them out of that box of everything fits here and to start looking at individuals.
Because placing Kim in a box, so to speak, almost landed her in a wooden box.
So I am a cancer survivor. Be 2 years in June. And when I first started talking to my doctor at the time, about years ago, when I said that I was having problems with my menstrual cycle, he told me it was because I was fat. He said, you just need to lose weight. That's it.
We want to humanize the human experience so that every person feels like they are valued and that their lives and their bodies are valuable, and especially when they're seeking health care.
When we come back, a look at the concrete solutions for creating a more equitable healthcare system and the impact a hospital closing has on a community. Back here now, we wanted to take a look at the question, how does a hospital affect a neighborhood? It's more than you may think. Matt Pearl shares the story of one hospital closure and why we should all be paying attention to this trend.
There's no denying the history 1 mile east of downtown Atlanta. It's the birthplace of Martin Luther King Jr., the home of Ebenezer Baptist Church. Within a mile's walk are testaments to Black persistence.
This is our community. Our office is located 2 blocks down from here.
But Luis Negron and many like him work to protect this community today, which on this day means speaking up about the 7-story chasm that now exists. What was your reaction when you heard this hospital was closing?
I was devastated. My heart was devastated for the community to know that they won't have access to health in this area.
We speak on the sidewalk of what was once a hospital. It was first called Georgia Baptist Hospital and most recently Atlanta Medical Center. Now there's no name. The hospital shut down in November, part of what some see as a pattern.
People have been here for generations. With it now being gone, it's going to be a plight in the community of healthcare and access.
When we are talking about hospital closure, it's mostly rural.
Janani Tapa teaches and studies rural-urban disparities at the University of Georgia. For a decade, the narrative around hospitals shutting down has focused on the nearly 200 since 2005 that have closed in rural areas. But in recent years, hospitals have shut down in Chicago, Philadelphia, D.C., with a similar pattern to Atlanta.
We are a state where we need to do a lot of work in making sure that everyone has equal access to health care.
On August 31st, the nonprofit overseeing Atlanta Medical Center announced plans to cease operations. Wellstar pledged to continue its commitment to the 1.6 million Georgians across our diverse communities. But the communities it vacated in Atlanta and south of the city East Point are largely low income and Black. This isn't an isolated space somewhere.
No, it's not. But I would say the community is very isolated.
When rural hospitals close, residents are often left dozens of miles from the nearest option. In cities, there's at least the illusion of access. Grady Hospital is in the heart of downtown. It's now Atlanta's only level 1 trauma center.
This was a walkable hospital. So many people will walk here during the day, during the evening. If there was an emergency, they could get here very quickly. Even though we see Grady across the highway in a corner, it's a much more difficult track to get there than this one here.
In November, leaders at Grady declared it isn't going anywhere, but acknowledged an influx of patients in our emergency department and trauma volumes. The future of the former Atlanta Medical Center is unclear. But when it comes to access to health care, it's another reminder of the many issues that affect 2 communities that rarely communicate. Those miles away from the city and those 1 mile away from downtown.
I think it's a loss in the community. I think it's a lost opportunity.
In Atlanta, I'm Matt Pearl.
Over the last half hour, you've heard from patients, doctors, educators, and advocates about why inequity in healthcare is so harmful. But where do we go from here? How do we ensure that every person, no matter their gender, their race, or ethnicity, receives quality care? A lot of it begins with examining our own biases. By now, it should be no secret.
I mean, bias and racism is everywhere.
Even in healthcare.
You all right today?
Yes, sir.
All righty.
And that's coming from a doctor. After talking with Isaac Apole and Christopher Brown, two black doctors, I learned bias can cut both ways.
The cultural literacies that you have to overcome sometimes, the medical literacies you have to overcome sometimes, and when you don't look at it holistically, I think the overall patient care suffers.
I had my first black patient with cystic fibrosis, which is a white condition, and it was a mental mountain for me to climb to look at this dark-skinned young lady and accept that she has cystic fibrosis, because we've always been told that's a disease of white people.
You know, I've often been told and grew up thinking sickle cell is a disease that only impacts black people. After talking with these doctors, I learned it's a trait with origins dating back to Africa. It formed as the body's developed response to help fight malaria. You know, white people live in Africa too, so white Africans sometimes get sickle cell. How do we eliminate these biases on the front end so that we don't have more doctors who've been practicing for 10, 15, 20 years that still kind of spread this false narrative?
There is a lot of hope that these false narratives are going to be eliminated eventually. And this is coming from the younger physicians now in training. Resoundingly, our students have told us that we can no longer perpetuate those biases. So the hope is race-based medicine,
where providers care for someone based on their race,
will soon be a thing of the past.
like saying that you have a certain disease or that you're going to develop something because you are Black or African American, or that you are from the Latinx community.
Dr. Geraldine McGee and Danielle Binion are both in the Office of DEI, Diversity, Equity, and Inclusion at KU Med Center.
The health conditions for Black and African Americans have been grave.
That's why the Repair Project and its 4 components are so important: curriculum development and revision, staff training, clinical intervention, and community accountability. As of right now, the Repair Framework is only being implemented at 2 schools in the country: UC San Francisco and now University of Kansas Medical Center. Stop me if you've never heard a medical expert say this. Blacks have a higher threshold for pain.
That is one of the most pernicious stereotypes in the history of medicine in the United States. I have had patients report that they've been told that. I've had students report that they've heard that from some of their attending physicians who are teaching them.
How do we eliminate that from the classroom, not just pen to pad, but up here too?
And the issue that we're really trying to deconstruct is that for years, right, the medical field has measured that there are these different health outcomes. What they were ignoring are the social and structural determinants of health. And in the United States, racism is the largest structural determinant of people's health. It outperforms class, it outperforms education, it cuts through everything. And that's something as a society that we've never wanted to confront.
Even how doctors take tests for certifications and licenses are somewhat rooted in stereotypes and assumptions.
Misconception that it's only a white doctor thing, but it's not. It's ingrained in medical knowledge.
How can the Repair Project help you?
I think by sharing stories like this and letting people know that the way you're treated should be at a top equitable care, that everybody should have the same amount of care, no matter if you're Black or white.
So that doctors like Christopher Brown and Isaac Apole can continue to be aware of and mitigate all biases.
Say, building trust a lot of times when you first meet someone allows for better outcomes.
And so that women like Kim Weaver and Shalise Clay always feel valued and heard.
We should not get to a point where I rather choose losing my life than to deal with a doctor.
There has been a lot of wrongs that have happened. We can't go back and correct those wrongs, but we can correct the course to make sure those wrongs don't happen in the future. So that's why this project is important to me.
It seems like it's a long road to traverse, but it doesn't mean that it's not worth going down that road.
McGee and Binion, they're working to open a Center for African American Health, a healthcare facility specifically designed to overcome all root causes of unequal healthcare: social, economic, educational. The only other center like this in the country is in Denver. And we also want to give you tools to advocate for your own health. You know, many of the people we talk with, they recommend bringing someone with you to be a second set of eyes and ears at your appointments. The doctors at KU Health System also provided some tips. One, don't be afraid to ask questions about anything you don't understand. If you hear jargon, ask your healthcare professionals to cut through it and speak English. Also, don't be afraid to ask for a second opinion. It's your body, after all, right? Better a second opinion than a second surgery. And also speak up if you're not comfortable with the situation, whether you are the patient or advocating for a loved one. And 4, do share your fears and concerns, however trivial they may seem. It may be the difference between a smooth versus a traumatic experience. And lastly, be positive, assertive, and active in your care. It will go a long way in helping the doctors care for you. As we wrap up our report, we hope this story has been able to provide multiple perspectives on healthcare inequities, inequalities, as well as provide ways that society can make improvements. So to watch any of these stories anytime, head to KSHB.com or see them on our free mobile app. I'm Kevin Holmes. Thanks for watching.